to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate, subscribe at kevinmd.com/follow. Today, we welcome back on the show Christine Coe. She's a dermatopathologist. Her latest Kevin MD article is titled, "Is There More to Patient Safety Than Preventing Medical Error?" Christine, welcome back to the show.
Thank you, Kevin. Nice to be here.
So for those who didn't get a chance to listen to our first episode, I think we've been talking, it was over a year ago. Just briefly share your story and journey to where you are today.
Briefly, I'm a dermatologist and dermatopathologist, so I'm a physician and I'm a mother. And I think parenting has actually been the hardest thing I've ever done. We talked about that a little bit last time. But this past year has been the most difficult year for me because in addition to just the COVID pandemic and the work stress that I think we've all been feeling, as well as home stress with like homeschooling for a lot of 2020 for I think many parents, and just all that associated with it, and just having to quarantine if anyone's sort of exposed or, that risk that's just ongoing and chronic. My son developed an acute vision problem. He didn't have one before, and all of a sudden he literally could not read or see far, so he was sort of functionally blind. And we had many, many ophthalmology appointments to try to figure out what was going on, as well as optometry appointments. And the two fields do not necessarily see eye to eye on this. And we finally got a diagnosis that I had never heard of called Streff syndrome. But then we went into vision therapy, which optometrists believe in, and most ophthalmologists apparently do not. But it was intense, and it was just a lot of work, a lot of visits, and a lot of questioning because of myself, because, Streff syndrome has a name, but part of it is stress, either visual stress or mental stress in terms of why it appears in someone. And so I really had to question whether, was there some trauma,
Sure.
stress wise to my son? And, is it me? And quite frankly, in more than one healthcare visit, it was implied, sort of, not exactly like, have you considered that this might be related to you or your stress and what the pressure that you might be putting on him? No one actually ever said that, but it was implied. And one time, even sort of a little bit more directly said to me by the vision therapist. And so the article's about that, how I actually started crying and he felt very uncomfortable, but he sat with me. And I didn't want to be sitting with him, but I didn't have plans to change to a different therapist at that point. So it was important to have a conversation with him. And through it, sort of, I realized that, I'm sure a lot of patients feel like this with me, that they don't want to share certain things, but they have to in order to get the right medical care. It might be embarrassing for them. For me, I realized it was very shaming what he had said, to think that I'm a bad mother, basically. Bad enough that, the vast majority of kids do not have a vision issue like my son did. And wow, like, how awful of a mother am I to potentially have induced that? That's how I felt, like, in the moment, and how at low points I felt at different times. The reality is, I know on a logical basis that it is in no way my fault. And I am not the kind of parent that puts so much pressure on their kids, despite my being Asian. And maybe on surface, maybe people could consider me stereotypically like that tiger mom. I'm actually really not. And the vision therapist even said so. He's like, well, the only person that can really answer what type of mom you are your kids. And so I can say whatever I want. And I recognize that sometimes you do everything right, and still, a child can have various problems, including medical, which I think if a child has leukemia, no one's going to blame the parents,
Sure.
So it was just sort of a very difficult year of being on this sort of ledge of a medical diagnosis, and yet there is, to some degree, some amount of stress or literally hysteria within the handout that they gave me. And a lot of self-reflection and awareness of just, what am I doing with my life?
Sure. Yeah, so you talk more about that story. This is your Kevin MD article titled, Is There More to Patient Safety Than Preventing Medical Error? So let's unpack what you said in that exam room. So I guess when it was implied that stress was leading to some of the symptoms that your son had. So take us in that moment into what you were thinking, and how did you unpack that when that clinician implied that to you?
Well, I'm a crier, so I think that the way I express my emotions, whether it's happiness, whether it's sadness, whether it's fear, whether it's anger, whether it's shame, I will cry. So I think, on the surface, you're like, wow, this person's crying. But literally something makes me happy and I will cry as well. So I think for me, because I've realized also through like the past 15 years,
Yeah,
ever since I had kids, that especially initially was very emotionally unaware and unable to label how I was feeling. So in the moment when he said that, the first thing I felt was I was like, I'm about to cry. And so then I'm like, well, I know I'm not happy. And I didn't know right away at first that I felt shame. That took me a while, but I knew I was going to cry and I knew that I didn't feel good. That
hmm,
was all I felt. That was all I knew in the moment that I felt because I was flooded with
sure.
that emotion. And
Now, were you surprised when the clinician said that?
yeah, I was surprised. I mean, at that point, we had been seeing this vision therapist for 4 months. And so every 2 weeks and for 30 minutes. And well, it's interesting because he had previously suggested that I'm a pushy mom,
Hmm.
and I didn't cry at that point, but I was sort of like, "Why would he think that?" And I came home, this was probably, like, several months before, and I came home and I was upset, and I'm, like, literally eating Nutella
Yeah.
with a spoon in the kitchen, and my daughter comes down, and she sees me, like, spooning Nutella rapidly into my
Yeah. Yeah.
mouth, and I turn around and I mean, my feelings are written on my face. I don't have a mirror with me. So,
Sure.
but my kids actually know me pretty well. And she's like, what's wrong? And I told her, well, basically he said I'm pushy. And I don't think I'm pushy. Like I mean, but let me ask you, do
Yeah.
you think I'm pushy? You're my child. And she was like, well, and she's like, well, and she's like, becomes then this like psychologist. And she was
Hmm.
like, why do you think he said that? And I was like, well, I mean, there are reasons he said that because I didn't trust the practice at first. So I said, I'm coming in the room during these therapy sessions. And he said, and this is the first time I met him, and he was like, well, normally the parent sits outside and here's a chair where you can sit and we're just going to be right here in this room and you can listen in, but the door will be basically almost shut. It's better if the parent's not there. I said, well, I actually don't trust this practice yet, and so I'm coming in, and my
Sure.
son asked me to come in before we got here, so that's what I'm going to do. And she just started laughing and she
Yeah.
started literally rolling on the ground, and she's like, and you think there's no reason why he would think you're pushy?
Uh-huh.
So, I mean, and then it made sense to me. I was like, okay, yeah, I guess I acknowledge that. But my son wanted me to be in the room. So he just
Sure.
didn't understand that piece. I think he didn't see behind the scenes of that. I think the bottom line is I think that I definitely have been and can be misinterpreted and misperceived by others, but that happens literally, I think, to everyone. So it's
Sure.
not like I'm special in that
Sure.
way.
So tell me what happened next. So once you talked to your family about this and kind of had time to process this. So tell me what happened next in relation to your relationship with your son and potentially your son's symptoms after you were told and processed this.
Yeah. So that was back in January, and my son's vision was already improving, I think, due to vision therapy, and we were doing vision therapy homework at home. And part of the difficulty through the years, he hated it. So yeah, I pushed him to do it. My son knew that I was going to make him do it. I mean, I did it with him, but really
Sure.
for like 15 minutes to 20 minutes every day, we were doing it. And but he would say periodically, I hate this, I
Hmm.
hate it, but it's actually helping. So, I know that we have to do it. So, and I think they're things that we all hate, even as adults, and that I call them my adult tantrums. I'll throw a tantrum, before or after, like in the middle of doing it. So I think he was just having a normal reaction. But basically what happened is I talked to my family about it, what I had been told, and asked that, that it's me kind of, or I'm contributing. And
Sure. What did they
and I
say when you shared that with them?
my daughter and my husband said no,
Mm-hmm.
it's not true.
Mm-hmm.
My son, you know, he's younger. He just turned 12. I mean, I think honestly, we don't know why it happened.
Sure.
I tend to think that it's sort of something his body had to go through, kind of like as sort of like just like a puberty experience.
Mm-hmm.
And I think there's a genetic component because through vision therapy, we realized, because I was in the room and he accepted vision therapy, accepted it, but he would like sometimes say, okay, we'll do this so that you know then what he's supposed to be seeing. And I don't see the right way
Sure.
either.
Sure.
And when my daughter was in 7th grade, she was having vision problems, but they were not severe. But I realize now that she probably does need some minor form of vision therapy, and it'll help her because she has trouble reading. She's not dyslexic, but she has
Sure.
some trouble reading. So, I think our family recognizes that there's this genetic thing,
Uh-huh.
and perhaps since they also say it's not just mental stress, but just visual stress, like just too much stress on the visual system, meaning too much for us to handle. And I think there's extreme forms of that where you see something horrible and then you kind of go momentarily blind for some period, that's been described. So, but to some minor degree, like less than that, like he didn't see anything horrible actually, but I think maybe partly because he is deaf as well, that he was taxing his visual system
Sure.
to a degree that was greater than his visual system slash brain
Sure.
slash body could handle.
Now, when that clinician approached you with what was a clearly uncomfortable implication, how did that interaction go? Do you feel like that clinician could have improved that interaction when he implied that that stress may have been coming from you? How did that go? Like, is there something that could have been done better in that interaction, or did he or she do a reasonable job of that?
I think he did a reasonable job after I started crying, and I was about to turn her away and just say, okay, because the visit was over and he
Yeah,
was just explaining something. So I was going to say, turn away and say, okay, well, we'll see you next week with my face turned away and
sure.
just leave. And instead I looked at him and I don't know, remember what exactly I said, but I said something like, why would you say that? And I think he was sort of taken aback because he was like, what do you mean? Because to him, I don't think he thought that he said anything. So, I may have also misperceived a little bit what he said, but I said, I think you're saying that I have some role in this. And
Hmm.
I just want you to know that I don't think that may be, but I don't think that how you said it just now is really useful, like helpful. And I started crying when I was saying that. And he was really uncomfortable, but he what he did was he immediately sat down because we were both standing at that point because the visit was over.
Sure.
And he said slowly, he said, please sit down. So I think that was helpful because he made me sit down and then we talked for probably about 30 minutes. So it was lucky, I think we were his last appointment of the day. And he took the time, he was willing to take the time. And I will say that I did, since I've known him since the fall, I do think he's a caring individual. And he wasn't like malicious intent. He didn't mean to hurt my feelings, which is why he sat with me. But I think he actually has been unaware throughout of how I've really been feeling and how we as a family, as well as especially my son, have been impacted by this, by the vision loss. And it's just sort of like, well, like life goes on kind of. And
Yeah,
I think
yeah.
I do that to my patients too. I don't really know, like, what does it feel like to have a rash every single day and it's itching like crazy and it's driving you crazy and you work at the same time and maybe you can't put on the medicine like when you need it and you're in a meeting like for 5, like we don't think about those things and we seem callous and just like, well, why didn't you use your medicine?
Yeah. We're talking to Christine Coe. She's a dermatopathologist. We're talking about her most recent Kevin MD article titled, Is There More to Patient Safety Than Preventing Medical Error? Christine, as you reflect on this episode, tell us some things that you've learned from it and maybe some take home messages that you could leave to the Kevin MD audience.
So one thing I've been learning recently is that shame, I think the natural reaction is to turn away from it. Both when I feel shame, I want to turn away, and the people around me want to turn away because they want to, they don't want to embarrass me or shame me anymore, right? So
Yeah.
you almost think it's like a considerate thing to like turn away, like, oh, we get uncomfortable and we just sort of move away. And it's okay if other people move away, but I realize that it benefits me. Shame it's very uncomfortable, but we all feel it and it's all over medicine everywhere. I think without intent, shame my patients. And I've been shamed as a mother, like I just described, but it happens in home life, etc. Like we just think shame is about being self-conscious and feeling that you're not reaching some standard. And I think as doctors, since a lot of people listening into this are doctors, we have such high standards for ourselves that I think that perfectionism is a form of shame because we want it to be perfect. That's the standard, and we're not going to ever get there. So we're going to shame ourselves if we're aiming for perfection. And so I would just say for maybe all of us, if we could normalize shame, and that's what I wanted to do today, and just say, this was an awful experience for me. I don't actually want to be reliving it, but the only reason I did so with the writing and wanted to be on today was just to say, like, I think one way the world perceives me is very accomplished, and yet I still feel shame like all the time.
Mhm.
And so it's just a universal experience, I think. And I think if we're more honest about it in medicine, we'll be better doctors, we'll be better teachers, we'll be better family members, we'll be better friends, just everything. And that's what I would want to leave everyone with.
Christine, thank you so much for sharing your story time and insight. And thanks again for coming back on the show.
You're welcome. Thank you for having me.